My name's Nathalie MacDermott and I'm a paediatric specialty registrar working in Swansea in South Wales. I've recently returned from working at an Ebola case management centre in Monrovia in Liberia with the aid agency Samaritan's Purse International Relief. I went to Liberia because I could see an epidemic that was spiralling out of control, and I wanted to go and provide practical skills to look after patients with Ebola and to support the work that Samaritan's Purse were doing in their Ebola case management centre. I went because I felt God had called me to work there, but I also went because I felt that I had the practical skills that could benefit the Liberian people. Whilst I was in Liberia, unfortunately, two of my US colleagues, Dr. Kent Brantley and Nancy Wrightwell, contracted Ebola, and this was a very stressful situation for us, as we were very concerned about them, but we continued on with our Ebola case management during that time as well. On arrival in Liberia, the situation was much worse than it had appeared back home here, and it felt like we were sitting on a time bomb that was gradually exploding underneath us as more and more cases started pouring into our Ebola case management centres, and we rapidly ran out of beds and were trying to take special measures to create beds in locations we probably wouldn't normally have placed them. Yeah, so additionally our work in Liberia was somewhat compromised by there being large levels of civil unrest and riots, which prevented us from building a much larger Ebola case management centre that could have held initially up to 60 patients, although I believe that has now been constructed and is holding more like 120 patients. So the civil unrest caused stress, as well as the increasing numbers of patients and inadequate facilities in which to accommodate them. We took every measure we could to protect our staff. We had very sound protocols, and we had plenty of personal protective equipment to protect our staff whilst treating Ebola patients, and also to look after the Ebola patients optimally. Our staff needed to feel safe, and I feel that we did achieve that in our case management centre. We were doing our best to provide the best care we could for our patients, despite the circumstances, and whilst our facilities were limited, we did have plenty of intravenous fluids and IV lines and antibiotics and antimalarials with which to treat them, and we did our best to control their symptoms as well. Whilst it was difficult as a doctor to manage so many patients and know that very few would survive, it was also very satisfying to be able to support people who were alone and afraid and in pain, and to comfort them, to provide them with medicine to support their symptoms and give them pain relief, and also to just have the opportunity to pray with them and bring them comfort, which wasn't necessarily happening in other centres where staff were often too afraid to look after patients. So whilst I was there, we had one patient survive who was a 12-year-old boy called William, and that was a wonderful day that he left our treatment centre and we were allowed to return him to his family. There were two other patients who also survived Ebola, but they were discharged from the centre after I had left Liberia, but I was informed by my colleagues that they had survived and been discharged as well. So that was wonderful news, but unfortunately that's only 3 patients, and the rest of our patients did not survive. So on my return from Liberia, I took all measures recommended by Public Health England to protect the UK population. Due to my contact with Kent Brantley and Nancy Wrightwell, it was felt important that I isolate myself from any direct physical contact with people for 21 days, which is the incubation period for Ebola, to ensure that I didn't develop any symptoms of Ebola, which I did. I returned to my apartment in Cardiff and I had no contact with anybody for 21 days, and I remained in my apartment during that time. And now I have returned to work after a brief time visiting my family, and so I have been back from Liberia for 29 days and I've remained symptom-free. Yes, I would go back. If my employer would grant me the time, I would, because the situation in Liberia at the moment is very difficult, and it's deteriorating rapidly, and what's really needed is not only finance and equipment, but healthcare workers on the ground to support the work of the Ministries of Health in Liberia, but also in Sierra Leone and Guinea, and there are not enough staff at the moment, and I can't bear to sit here and watch that situation deteriorate further, knowing that I might be able to help, even if just in a small way.